afternoon. We're going to get started in a moment to allow folks to enter into the meeting from the lobby. Thank you. I'm glad you have joined us. My name is Michelle Cunningham, Marketing and Outreach and Healthcare Workforce Development. And I have placed the link to the slide deck in the chat, and this deck is posted on our website. Before we begin, I'd like to discuss a few housekeeping items. This webinar will be recorded and the chat option is open. We will entertain the questions in the chat during the Q&A session, which is at the end of this webinar. In addition, during the Q&A session, your mics will be enabled and you'll be able to raise your hand to ask questions. And I am thrilled to introduce our presenter, Michael Andrich. He is a program manager with the Healthcare Workforce Development. Thank you, Michael.
Thank you, Michelle. Welcome, everyone. Thank you for attending today's webinar. I will be going over our Allied Healthcare Scholarship Program today. So with this program, the Allied Healthcare Scholarship Program is for applicants who are currently accepted or enrolled in a following Allied Healthcare program, which also encompasses behavioral health professions, which include our behavioral disorder counselors, certified nursing assistants, home health aides, marriage and family therapists, mental health counselors, occupational therapists, occupational therapist assistants, psychiatric aides and technicians, rehabilitation counselors, substance use disorder counselors, and social work. With this program, the maximum award amount that an applicant can receive is up to $25,000 for a behavioral health profession. Now, HCI can award full, partial, or no funding dependent on the applicant's success in meeting the scoring and selection criteria, as well as the amount of available funding that we have. Applicants will not be awarded more than their cost of attendance for 1 year program, as well as we will not award more than the maximum amount. So in this case, if somebody had $26,000 for their cost of attendance, we wouldn't award 26, we would just go up to that maximum if we have the available funds. Applicants can apply as many times as they would like, but if they only could be awarded up to 3 times. If awarded, grantees will receive a one-time payment at the time of the contract execution. This allows for those applicants to have those funds ready prior to their program starts to pay for any of those fees that they need. So scholarship program eligibility. In order to be eligible for this program, they must be starting the program by October 22nd, 2022. They need to be enrolled in a minimum of 6 units or the equivalent until the program completion. They must maintain a 2.0 GPA or greater until program completion. They have to be free from any other service obligation, including other scholarships or loan repayment programs. They must not be in breach of any previous contracts with HCI, and they must commit to providing a 12-month service obligation upon graduation. And part of the other requirement of that is they must be providing 32 hours or more per week of direct patient care. So how we verify if a site is eligible for this program, it's based off geographic or site designations. So the facility could be in a geographic location that qualifies, or it could be a qualifying type of facility. And those are health professional shortage areas for dental, your health professional shortage area for primary care, your health professional shortage area for mental health, your primary care shortage area, state health facilities, county health facilities, your children's hospitals, correctional facilities, Native Indian health centers, rural health care centers, federally qualified health centers, veterans facilities, and public school facilities. So these are all either geographic locations or sites that qualify for the Allied Healthcare Scholarship Program. And this applies to once they graduate, when they need to find a practice site. So the application cycle is currently open and we are accepting applications. If someone is interested, they will need to complete an online application through our web-based eApp program, which is the funding.hci.ca.gov. And you can also find this link on our HCI website. At the time of the application, they'll complete it and they'll need to submit the following attachments. A certification of enrollment form, and this is just giving us the details of the program that they're enrolled in and when they are expected to graduate. A cost of attendance for 1 year. This is showing all the fees and costs that are going to be associated to be in this program for up to 1 year. And they can obtain this from the school's website or their financial aid office. And then a conflict of interest letter. This is only for individuals that maybe have worked or volunteered for the state in the past. We just want to make sure that there won't be any conflict. So if awarded, once they graduate, there will be a monitoring period when they're serving their 12-month service obligation. Once they graduate, within 30 days, they need to submit a graduation date verification form to program. And this is just certifying that they did indeed meet the requirements of the program and they did graduate. Over the course of their 12-month service obligation, grantees are going to be required to submit 2 progress reports, which have to be signed by the grantee themselves, as well as their direct supervisor. And this progress report is certifying that the grantee is maintaining their hour requirement, which is the 32 hours per week, providing direct patient care. Any changes regarding employment, for example, change of work site, hours, location, will require a new employment verification form, and the employer must be verified for program eligibility. Now, we don't sway people from not changing employers. They most are welcome to change employers as long as it's qualifying and they let us know. If a grantee does require time away from the practice site, they are allowed up to 4 weeks away. If that absence should exceed that allowable 4 weeks, then they would need to let us know and we would need to do an amendment for their contract to extend that date. Very short and sweet, but this brings us to our question portion.
Thank you, Michael. Please feel free to place your questions in the chat. Also, you may raise the hand icon. You'll find the hand icon on the top of your screen with the reactions button. Once you raise the hand icon, you'll be placed in a queue. I'll call on you. To unmute yourself, the mic button is at the top of the screen. Please mute yourselves after speaking and lower your hand icon. So thank you, Michael. And any questions? From Laura Noel, will we receive a copy of the slides for information purposes? I can answer this. The slide deck right now, it's the link is in the chat and it's also on our website. And the webinar recording will be posted on our website soon.
And just to add to that, if you go to our website on our Allied Healthcare Scholarship Program, you can find a grant guide for this program, which goes into more depth about the program requirements and eligibility.
I'm sorry, I'm actually on my cell phone, so I
Oh,
don't know if I'm able to raise my hand. I'm not too familiar with Microsoft Teams, but is this scholarship granted after graduation, or is this something to help support us through graduation and then you monitor our progress?
Yep, so this will be prior to your graduation, and then once you graduate, you'll serve your service obligation after that.
Okay, and then the service obligation would be the hours that would be required or that are asked of us upon applying?
Correct. So once you
Okay.
graduate, you'll have about 6 months to find a qualifying employer. If you need more time, you just let us know. And then once that employment is secured, then we begin that 12-month service obligation.
What if we're currently working in the field?
You can definitely stay there. We won't retroactively apply those hours, so it will still start once you graduate. But if you already have that employer set and it does qualify, then that's okay.
Perfect. Thank you so much.
You're welcome.
checking if you see the link now. I put it back in the chat. Folks are not seeing it in the chat. Maria, I'm interested in finding more information regarding loan repayment for Allied Health. Is there a webinar for that information?
At this time, we don't have a webinar for the loan repayment program. However, we are going to be preparing to open that cycle up in September. And so we will be putting together a grant guide, and that will go on the program page on the HCI website. And that will go over the eligibility requirements for that program. But feel free to also reach out to us via email, and we'll be more than happy to assist you with any questions.
Any other questions in the chat or raising hand? From Maria, who should I reach out to? She was the one who asked about loan repayment. Is that correct,
So-
Maria?
Yes, I think that was the Allied Health. Yeah.
Yes.
So if you
that's
go on the website, there should be a contact email on there, and you can click on that link and send the email via there, and then we'll reach out to you. And that'll come directly to our team. So
From Brian, so I need to be enrolled in a program first, is that right?
you need to be currently enrolled or at least accepted. So when you're applying, if you are accepted, you'll just need to show proof upload that you are registered and are going to be attending in that program at that time.
Welcome, Brian. From Nolan, I apologize if this question has already been asked. I'm hoping to share this information with my staff, and I'm sure they'll want to know if our substance abuse treatment center is an approved site. How do I find out if we are?
So you can actually email this email that's up here on the slide, the SCH-HWDD@hki.ca.gov with your site and the address, and we'd be more than happy to look that up for you and let you know.
From Stephanie, when can we start the application process? I went to the website and it said access denied when I clicked on the application link.
So the application is live. Most of the time when you're hitting an error that's saying access is denied, is in your profile, you have to select that you're a student. There's also a selection for organization and healthcare professional. If student's not selected, it won't let you apply to the scholarships. And if you still are hitting any errors or any issues with our system, please go ahead and email this email address, and we'll be able to get that taken care of for you.
From Laura, does this pertain to not-for-profit organizations?
Yeah, so this can apply for that. It's also based on the address of the facility. So everything as far as requirements for the facility, we would need the address so that way we can look up its eligibility.
Another question from Laura, what areas of California are underserved? Is there a map?
We unfortunately don't have a map. There are several areas that are underserved. If you're looking for particular sites within a county, you can also email us, and I can share with some of the sites that we have awarded in the past. But at this time, we don't have a map that shows all the underserved areas.
Laura asks, is Tulare County?
Tulare County is an underserved area, but again, the facility will have to be designated as underserved. So that's why we'll need the address to verify and check that facility.
Welcome, Laura, and welcome, Stephanie. You still have time for more questions, or you can raise your hand, or if you're on the cell phone, open up time. From Laura, where do I email the addresses?
You can email that address to the SCH-HWDD@hki.ca.gov email. And then we'll get that address, we'll look it up for you, and we'll respond via email with that eligibility.
From Maria, how do you go about submitting an address so it can be added to the underserved list?
That would actually be with another unit, I believe, with our designations unit. If you want, you can send me an email through the scholarship email that's listed on the slide, and I can get you the correct contact for that.
From Madeline, is the application for loan repayment competitive or just based on need?
It is a competitive process, because it is based off of available funding, so it is a competitive process.
And Maria says, thank you for your
You're
early
welcome.
response. And then Michael, had you mentioned that this application is open, and what, did you mention the deadline so folks know that they have time?
So the
Okay,
application is
great.
currently open. We are gonna be closing this application cycle on October 31st, 2022 at 3:00 PM. So you still have some time to apply.
Alicia, is the grant for those that are in their undergrad programs only?
Nope. You can be in upper grad as well, graduate program as well.
And Maria's asking for your email, or do you want the email on the screen to be used?
Yeah, if we can use the email on the screen, that way the team can respond to that.
From Brian, I did not see psychologist listed as part of the other groups, for example, social worker and LMFT. Wouldn't they fall under mental health?
They do fall under our mental health. They're just not covered under our allied scholarship program. At this time, we only have a loan repayment program for them under our licensed mental health services provider education program.
From CJ, can you use the funds for a certification process like CCAPP?
The funds should only be used for your program, not certification. So it's for the cost of attendance for attending that program. So for tuition, books and supplies, housing if needed.
Thank you, Michael. I think we'll give it a few more seconds to see if any other questions before we close it out. How's that sound, Michael?
That
You know,
works.
hello.
Yes, go ahead.
Yeah, I got there kind of late, but there's 32 hours that need to be done when? Every week or
Correct. So upon graduating, the service obligation is you would have to find a qualifying site, and then you would need to be providing 32 hours of direct patient care per week for the 12-month service obligation. So that's after graduation.
thank you.
From Nolan, is there an alternative email address? The one listed was kicked back to me.
Yeah, I can put one in the chat.
From Aaron, will you send the presentation after the meeting? Do you mean the recording? I'm not sure what you mean by presentation, Aaron. If you want to pop on and unmute yourself and with a follow-up, but the slide deck is posted on our website. This webinar recording will be posted in the next few days on our website, if that's what you mean by presentation.
Yes, thanks.
Thank you. From Stephanie, approximately when will we know if we were granted this scholarship?
So we're looking to have everybody notified at least by late December, early January.
And Michael has noted his email address in the chat, and you're welcome, Aaron. From Regina, is there a list of agencies or organizations that have been approved to complete the service hours after graduation?
We don't have a list on our site, but I'd be more than happy to share that with you. If you want to shoot me an email, I could put together a list of what we've awarded in the past as far as what organizations and facilities have qualified.
Welcome, Regina. When I announced like 30 seconds more, then we had more questions. So I'm going to announce again about 30 seconds more to open it up for more questions, which is great. We're available. Okay, I don't see any more questions coming in. So Michael, you want to just wrap it up, please?
Yes, so thank you everyone for attending today. Again, we're always available for questions. So if you want to reach out to us, go ahead and use my work email or the email on the slide. And you can also give us a call. Again, I would strongly encourage you guys to check our website, the Allied Healthcare Scholarship Program page, and take a look at the grant guide. It's full of great details on program eligibility and criteria. So thank you again.
Thank you.
Thank you so much.